So let's look at centralization. So centralization is when the pain starts in the low back and moves down the leg. Well, actually, centralization is the opposite of that. So when you start to have pain, the pain usually starts in the low back and then starts to move down the leg. As we're doing the movement tests, what we want to happen is that pain to start to subside. If you've got pain all the way down into the foot, it starts to subside and it starts to move up until all the pain is right in the center of the back. That is what we want. If you're doing the movement screening and you find that the pain is moving down the leg or further down the leg towards the foot, then stop that movement. That is not what we want at any time during this program. If that starts happening, that is not the right movement for you. And we need to find a better movement strategy to reduce the stress on the tissues. So here's the movement testing. So the first movement testing is this forward flexion. You're bending forward and you're going to do that about 10 times and you're going to go nice and slow and you're going to see how your pain responds. Does your pain increase? Does your pain decrease? Does it centralize? We're learning how the pain responds to this movement. The next movement is the backward bend. You don't have to have your arms up like this person. I prefer to have people with their hands on their back to provide a little bit of support. And the same thing, you're going to do that 10 times and you're going to see how your pain changes. Does it centralize? Does it get worse? What is happening here? Last is the lateral or slide glide. This woman is doing it against the wall. Basically, she's pushing her torso, she's pushing her shoulder into the wall, gliding towards the wall, pushing herself towards the wall, pushing herself in that direction. Same thing, you do that 10 times. You want to do that on both sides, and you want to notice what happens. Does your pain increase, decrease, centralize? What is going on with the different movements? So this will help us, the results of this will help us classify you, and hopefully you've already been correctly classified through the quiz that you took to get into this course. So let's look at the different McKinsey tracks. You're going to be in one of these modules, not in all of them. There is some overlap between some of them, and in the individual modules, I will be mentioning the differential diagnosis, so the other types of pain you might have that are similar, so that we can ensure that you're in the right place. So the first one is posture-related pain. This often happens from slouching or leaning in a certain direction, and it's very posture related, so it responds very quickly to the intervention. Then we have centralized back pain. This is pain from a spinal derangement that improves or moves towards the center with certain repeated movements. Again, this is one that we want. If your pain can centralize, that is a good indication that it's going to respond really quickly and easily to the treatment. We have one-sided spreading pain. So this is when you're moving your torso side to side here, and that shift causes pain on the same side. So when you shift to one side, you're going to get pain down the leg on that side. So this is the one-sided spreading pain. Then we have the cross pattern pain. So this is a spinal derangement causing symptoms on the opposite side from the spine sideways shift. So this is basically the opposite of the one-sided spreading pain. In one-sided, you shift to that side, you get pain on that side. On the cross pattern pain, you shift to the other side and you get pain on the opposite side of the back or leg, possibly all the way down to the foot. Then we have stiffness related pain. This is pain only at the end range of the movement. And it's often caused by short or tightened soft tissue. And this is usually related to some sort of past injury or stress. So you don't have much pain until you go all the way to your end range. And that's when the pain will show up. You don't have pain really in your daily life unless you're doing a specific movement. And at the very end of that movement, that's when the pain shows up. Nerve tension pain is pain from the nerves that have tension on them. They can be stuck or tethered to tissues. It can sometimes be adhesions. And the type of pain is more sharp or shooting pain, and we'll identify that with the movement screening. There's complex radiating pain. So this is another spinal derangement. And this is one that doesn't improve or centralize with movements or postures. So if you went through that screening and nothing really changed, then you most likely have the complex radiating pain. And there is something that we can do about that, but this is a slightly more difficult one to work with and takes a slightly more time than a lot of the other ones. And then last is the complex back pain. So this is a type of pain that doesn't clearly fit into any of these previous categories. It's a mechanical pattern. We will give you some suggestions if you have complex back pain, but usually you need some further evaluation or some hands-on care. This one is very difficult to treat with an online course or with these movements. It's pretty complex. And so we'd be happy to guide you and help you with that. Well, that's it for the course. Thank you, or for this module. Thank you for watching this module. And next, we'll be going into the specific type of back pain that you have and giving you all the resources that you need to successfully self-manage this and get back to the things you love. So I'll see you in the next module.